Medical ethics is a complex and constantly evolving field that deals with some of the most challenging questions in modern society. From the ethics of clinical trials to the question of when it's appropriate to withdraw life support, the decisions that doctors and researchers make can have a profound impact on people's lives. Over the next few minutes, we'll delve into some of the most pressing issues in medical ethics, including the ethics of clinical trials, the question of when it's appropriate to withdraw life support, and the thorny issue of euthanasia. The history of clinical trials goes back centuries, with some of the earliest recorded trials taking place in the 16th century. However, it wasn't until the 20th century that clinical trials began to be conducted on a larger scale, with the development of new treatments for diseases like tuberculosis and polio. In the decades that followed, clinical trials became an increasingly important part of medical research, with thousands of trials taking place each year around the world. At the heart of clinical trials is the concept of informed consent, which requires participants to be fully informed about the nature of the trial, the risks and benefits involved, and their right to withdraw at any time. This concept is rooted in the ethical principle of respect for persons, which holds that individuals have the right to make their own decisions and should be treated with dignity and autonomy. However, ensuring that participants are fully informed and able to make their own decisions can be challenging, especially in cases where participants may be vulnerable or lack access to information. For this reason, clinical trials are subject to strict ethical guidelines, which are designed to protect the rights and welfare of participants. Despite these guidelines, controversies have arisen over the years regarding the ethical conduct of clinical trials. In some cases, participants have been subjected to harmful or unethical practices, such as the infamous Tuskegee syphilis study, in which African American men were deliberately left untreated for syphilis in order to study the natural progression of the disease. Other controversies have centered on issues of exploitation and access, with some critics arguing that clinical trials in low-income countries may be driven more by financial incentives than by a desire to improve public health. In these cases, there are concerns that participants may not fully understand the risks and benefits of the trial, and may be pressured into participating due to financial or other incentives. The decision to withdraw life support is one of the most challenging and emotionally charged issues that families and healthcare providers can face. It involves weighing complex medical, ethical, and moral considerations and requires careful assessment of the patient's condition and prognosis. In making this decision, doctors and families must take into account a range of factors, including the patient's wishes, the quality of life, and the potential for recovery. Patients who have previously expressed their wishes regarding end-of-life care may have an advance directive or living will that outlines their preferences. In cases where the patient is unable to make their wishes known, families and healthcare providers may need to rely on other factors, such as the patient's values and beliefs, to make decisions on their behalf. The quality of life is another important consideration in the decision to withdraw life support. While there is no clear definition of what constitutes a good quality of life, doctors and families may consider factors such as the patient's ability to communicate, interact with others, and engage in meaningful activities. They may also consider the patient's level of pain and suffering, as well as the potential for future suffering if life support is continued. The potential for recovery is another critical factor in the decision-making process. While it is not always possible to predict with certainty whether a patient will recover, doctors may consider factors such as the severity of the illness or injury, the effectiveness of previous treatments, and the patient's overall health and resilience. Despite the complexities involved, withdrawing life support is sometimes seen as a compassionate and ethical choice. Some argue that it allows patients to die with dignity, rather than being kept alive in a state of suffering or unconsciousness. Others point to the importance of respecting patient autonomy, and allowing them to make decisions about their own end-of-life care. However, there are also ethical debates surrounding this issue, particularly around questions of the value of human life and the role of healthcare providers in making life and death decisions. Some argue that the decision to withdraw life support should be based solely on medical considerations, while others argue that it should take into account broader ethical and moral concerns. The topic of euthanasia and assisted suicide is a highly controversial issue that raises a number of ethical and legal questions. Proponents argue that it is a humane way to end suffering for patients who are terminally ill and have no hope of recovery. They argue that patients have a right to die with dignity, and that euthanasia and assisted suicide can provide a compassionate and merciful end to a patient's life. Opponents, on the other hand, argue that euthanasia and assisted suicide are morally and ethically wrong. They argue that these practices go against the sanctity of human life, and that they could potentially be abused by those with a vested interest in the death of the patient. Additionally, they argue that these practices could lead to a slippery slope, where euthanasia and assisted suicide become more widespread and accepted, and the lives of vulnerable individuals are put at risk. From a legal perspective, euthanasia and assisted suicide are currently illegal in most countries, including the United States. However, there are some countries and states that have legalized these practices under certain circumstances. For example, in the Netherlands and Belgium, euthanasia is legal for patients who are suffering from unbearable pain and have no hope of recovery. In the United States, assisted suicide is legal in some states, but only for patients who have a terminal illness and a prognosis of less than 6 months to live. From an ethical perspective, the debate over euthanasia and assisted suicide centers around questions of autonomy, dignity, and the value of human life. Proponents argue that patients have the right to make decisions about their own lives and their own deaths, and that they should be allowed to die with dignity and without pain. Opponents, however, argue that the value of human life should not be compromised, and that doctors and healthcare providers have an obligation to preserve and protect life. In addition to the ethical and legal considerations, there are also practical considerations that must be taken into account when making decisions about euthanasia and assisted suicide. These include issues of patient consent, the role of healthcare providers, and the potential for abuse or coercion. Medical ethics is a complex and often difficult field that requires doctors, researchers, and ethicists to make challenging decisions that can have a profound impact on people's lives. In this video, we've explored some of the most pressing issues in medical ethics, including the ethics of clinical trials, withdrawing life support, and euthanasia. We've heard from experts in the field who have provided insights into the complexities of medical ethics and the difficult decisions that they face every day. While there are no easy answers when it comes to medical ethics, it's important that we continue to have these discussions and debates. By understanding the ethical frameworks that guide medical research and practice, we can work towards developing solutions that are both scientifically sound and morally just.